It's the news we were hoping not to hear. British Prime Minister Boris Johnson says there's now evidence to suggest the new coronavirus variant first detected in the UK is not only more contagious but more deadly as well. The mutation has now spread to more than 60 countries and Britain itself is struggling to bring infections under control.
It's a relentless nightmare for healthcare workers across the UK. The shifts are physically and emotionally grueling. Countless lives cannot be saved. Many more people have been hospitalized than during the first peak last April. And a coronavirus variant known as B.1.1.7 is playing a significant role in the suffering. Scientists say it's almost certainly more infectious. And now government health advisors believe it could be more deadly, though they caution the assessments based on sparse data.
We've been informed today that in addition to spreading more quickly, it also now appears that there is some evidence that the new variant, the variant that was first identified in London and the South East, may be associated with a higher degree of mortality.
The UK has one of the highest death rates from COVID in the world. Almost 100,000 people have lost their lives, with ethnic minorities disproportionately affected. Those groups are also more likely to refuse vaccinations when offered them. So authorities are trying to tackle mistrust and disinformation. Mosques have joined the campaign to persuade sceptical Muslims.
I think that the key message there is that the vaccination is safe, the vaccination is effective, and the vaccination is halal and permissible under all sort of rulings of the religion.
The UK's been making good progress with inoculations, administering jabs to a larger percentage of its population than any other European country. But the government says restrictions won't be eased until infections have dropped and it's sure the vaccination programme is working.
Our correspondent Birgit Maas is standing by for us in London. Birgit, are these new findings likely to change the UK's response to the pandemic?
This is the question being asked, Rebecca, but for the moment the answer from the Prime Minister is no, because the UK is already in a pretty strict lockdown. I live in central London. The streets here are really mostly empty because people are not coming into offices to work. They are staying at home. They're working from home if they can. The schools are closed. Only essential workers can send their children to school. So they say it is already pretty strict. However, also we know from data that the mobility is still a little bit higher than it used to be in the first lockdown. So questions keep being asked, exactly who is more mobile and is that really necessary? And for example, fines are debated. Should there be more fines or more stricter enforcement of the lockdown rules?
What about travel restrictions? Could these findings lead to tougher border restrictions in both directions?
Definitely, that's a debate that's very much being had at the moment, not only in the UK, but also in the EU. Some countries have already banned flights and ferries from the UK, like the Netherlands, for example. So this is countries trying to protect themselves against new variants. So this new variant is now dominant in the UK, and other European countries are hoping that they can keep it at bay because it is more transmissible and now it seems also possibly more deadly. The UK itself, though, also wants to protect itself because the inoculation programme is pretty successful here so far. Over 7% of the population have already received a first dose. So medical experts are hoping that this will have an effect. And the UK does also debate whether there should be border closures in order to protect the UK from other variants across the world.
Indeed. Well, the EU would be right to be concerned because Europe's coronavirus vaccination rollout is facing a bit of a setback, with drug maker AstraZeneca telling the European Commission it won't be able to deliver the agreed volumes of its COVID-19 vaccine within the agreed time frame. AstraZeneca, which developed its vaccine with Oxford University, said it would have to cut initial deliveries to the EU by 60%. The company was expected to supply around 80 million doses by the end of March. It's blaming the reduction on production problems at a factory in Belgium. Birgit, the EU hasn't even approved the vaccine yet, and the company says the delay will be temporary. How much of a setback is this?
Well, across the UK and also across the EU, there is an absolute race against time, because we know that obviously vaccination, the availability of all these vaccines is for the moment is the problem really across the world. So countries are basically scrambling for vaccines. We know that in the UK there is a target to until mid-February to inoculate at least with one dose the most vulnerable groups of the population, but also government ministers admit it's pretty tight, and this is a situation that's replicated across the EU, really.
All right, Birgit Maas speaking to us from London. Thanks very much.